Intrathecal pain pump is a way to give chronic pain patients a better way to get their medicine delivered to them, and actually works better than oral medicines do. So what we actually end up doing is placing a small catheter into somebody's back, and they do get implanted with the pain pump, and it delivers medicine to that person 24 hours a day, 7 days a week.
I had a neck surgery that went really bad. I'd had a couple of other spine problems, but the C-spine problem, pills weren't fixing it, shots weren't fixing it. And Dr. Castillo proposed that we could do an intrathecal pain pump, run it right up to the inside of my neck, and deal with my pain in that way.
We mostly do them for people who have had surgeries that have gone wrong in the cervical spine or in their lumbar spine and have chronic pain after it. We also do it for cancer pain. We do it for chronic knee pains. We do it for mostly certain things that have been working on people. The oral opioid medications cause a lot of more side effects than most people realize. So most people who are on oral opioid understand that it causes constipation, which is the #1 kind of side effect. But it also causes you to have respiratory problems because it depresses the respiratory system. And it also can slow the brain functions.
I haven't taken any opioids or any barbiturates for almost 5 years. Everything goes into my spine, doesn't get into my brain, doesn't get into my bloodstream, and it shuts the pain down. Lets me live like a real human being.
We're getting them down to what they can live with, so they can actually go out and do functions. They can care for their house, they can care for their families, they can go to church, they can do what they want to do. I even have a guy that was basically came in the fetal position, who's now back out playing golf. Do I always have success? I'm going to tell anybody, if you've been in medicine long enough, you don't help everybody. But we probably are in the 90% range of helping people get better and back to having a life outside of popping pills all day long.
If you've got pain that nothing else is helping and they're just throwing more pills at it, there is an option. The intrathecal pain pump runs a catheter in through the spine, mine goes up into my neck, and shuts the pain off. You don't get high, you don't get buzzed, it doesn't get into your brain, it doesn't get into your blood. The medicine goes right where you need it and nowhere else.
So pumps can also be used for spasticity. So we can put, if you're getting a lot of spasms second to your surgery, we can put a drug in called baclofen that can help. We can add anesthetics in there that may also help for very certain conditions. So we can mix and match some things that can actually help the pain even better.
If it wasn't for the pump and the work that Dr. Castillo has done, I wouldn't be able to look at you like this right now because I wouldn't be able to hold my head up. What quality of life is that? You know, I'm 72 years old. I still have a lot of life to live. I have big dogs that I can play with and it doesn't hurt. You know, I live my life.